Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Breathe Easy, Managing Asthma, presented by Ryan Croft, Respiratory Therapist with Washington Hospital Healthcare System. Ryan is from Visalia, California, and has worked his way north to become the Respiratory Care Coordinator at Washington Hospital. He is a certified adult critical care specialist. Ryan received his Bachelor's of Science in Respiratory Therapy at San Joaquin Valley College. Please welcome Ryan Croft.
Evening, everyone. I'm going to take a little bit of time tonight to talk to you guys about asthma, how to manage it, things to look for, and what it is. So we're going to start off with what is asthma. It's a chronic disease of the lungs, specifically the airways, that may cause breathing problems throughout someone's life. It's chronic, meaning you may live with it every day. It can be serious and even life-threatening at times. There is no cure, but it can be managed so you can live a normal, healthy life. When we're thinking about asthma, we need to break the lungs down into two distinct sections. You have the airways, which are the pathways that air goes when you breathe in and out of your lungs, and then the alveoli, which is the actual sacs that contain the air down into your lungs. Asthma, specifically, affects the airways. On this slide, you could see a normal airway on your left. The center there is an asthmatic airway. You see there's swelling in the tissue and a smaller opening for air to go in and out. On the right, you can see an asthmatic airway during an attack. There's mucus production, and there's what we call bronchospasm, where the smooth muscle around your airways contracts and makes it more difficult to breathe. So what causes asthma? There's always a little swelling inside your airways with or without symptoms when you're someone who has asthma. The lungs may react to things that don't typically bother other people. We call these asthmatic triggers. So what's happening during an asthma attack? Well, there are three primary things that take place. Swelling or inflammation of the walls of the airways. This narrows the airways, making it harder for air to flow through. Extra mucus production takes place in the airways. Again, this clogs the airway, making for an even smaller opening. There's tightening of the muscles that surround the airways. This is what we refer to as bronchoconstriction or bronchospasm, and it reduces the opening of the airways even more. So back to this slide, you can see on that third one on the right, during the asthmatic attack, tightening of the smooth muscles, swelling the actual tissue of the airways, as well as increased mucus production. Compared to the far left, where somebody who doesn't have asthma, where air can flow much more easily in and out of the lungs. So what is happening during an asthma attack? When someone comes in contact with a trigger, the body then goes into an asthma attack or episode, causing swelling, mucus production, and bronchoconstriction. This creates a tightness feeling in the chest, making you have to work hard to move air in and out of the lungs. It may feel like you just ran a marathon, even though you were doing something simple like watering plants in the backyard. If you think of it as, imagine taking a straw, a normal straw you would drink out of every day, and having to breathe only through that. That smaller airway opening makes it more difficult, and you have to work harder to force the same amount of air in and out through that smaller opening. So how do we recognize asthma? So if you or your child experience symptoms such as wheezing, frequent cough, shortness of breath, or chest tightness, it's important to see a healthcare provider to determine if the symptoms point to asthma. So a physician will examine you while taking into account your health history, which includes things like family members with asthma, allergies, smoking and exposure to secondhand smoke, as well as exposure to pollutants in your workplace. If you have symptoms during exercise, you may receive an extra test to determine if you have something called exercise-induced asthma. But typically, This takes place within the first 5 to 10 minutes of exercise. If you find that later on in the exercise you're starting to have these symptoms, well, it may just be tired from the exercise. So how do we test for asthma? Well, there are several breathing tests you may have to perform. Spirometry refers to a test or series of tests that measures how fast you move air into and out of the lungs. When that opening that we talked about, those airways, are tighter, we can measure that, how fast you're able to move air in and out. Allergy testing, such as blood for inflammation markers, or a skin test to test the sensitivity of different allergies you may have, may also take place when you come in. Your physician may also try and rule out other diseases that share symptoms. Do you have a chronic pneumonia, or maybe flu or cold or RSV, depending on the time of the year? Once he rules those out, be able to tell much easier if it is a chronic disease like asthma. So now that we've determined if you have asthma or not, how do I manage it? Well, asthma is considered well controlled if you need your quick relief inhaler less than 3 times per week. You don't need to wake up with asthma episodes during the night, and you can do activities with few to no symptoms. According to the American Lung Association, there are 6 steps you can take to help keep your asthma under control. Make your medical visits more productive. So make sure you do your research and figure out the right questions to ask and things to look for before your visit. You can create an asthma management plan. You can work with your healthcare provider or your respiratory therapist to have steps in place in case an attack happens, making sure you have the right medications on you when needed. Assess and monitor your control. So keeping track of your symptoms will help you stay in control. Knowing what actually triggers your asthma and being able to stay away from that is a big help. Understand your medication. Understanding what each medication is used for and how it affects you. What are my short-term medications? What do I need to use in an emergency? And what do I just take on a daily basis? Reduce asthma triggers. So again, identifying what triggers affect your asthma and staying away from them for the most part. Is it secondhand smoke? Is it pollen? Is it certain changes in the weather? Or is it exercise? All these are common triggers. And then learn asthma self-management skills, which basically just ends up being go online, do your research, and figure out for yourself what's going on with your body. Tools at home. So we have what's called a peak flow meter that we give out here at the hospital, especially in things like the emergency room for people to take home. What that does is it helps measure how fast you can exhale. Well, if you do this over the series of a couple days and find that you're able to your exhale is slowing down over the course of a couple days, you may begin to experience an asthma attack. Or it may be a certain type of season that triggers that attack much more frequently. It's a simple tool that can be carried on you at any time or just left at home. So what medications are available to me? Well, we have quick relief medicine, which relaxes the airways and helps you breathe easier. Use when symptoms begin or worsen. These are short-acting bronchodilators, typically albuterol. These are what you see in the movies when you've got the child running around, he starts to wheeze and he pulls the inhaler out of his pocket. That would be a quick relief medicine. Long-term control medicines reduce swelling in your airways and prevent symptoms. So those you take daily, even when feeling well. These are things like anti-inflammatories, like steroids that are used during certain seasons where you find your symptoms are worsening. So, after all this, where can I go for more information? Well, the American Lung Association is a great resource at lung.org. It has resources for asthma for education, how diagnosis works, what tools are available, as well as help point you in the right direction. We also have the Center for Disease Control, which has their own National Asthma Control Program. These are resources for those with asthma that include guidelines and recommendations on general health and wellness. That is the end of my presentation. Thank you all for watching. We're going to look and see if anybody has any questions now.
Great. Thank you, Ryan. We do have some questions. The first question we have is, how do you differentiate between asthma and other breathing disorders?
It's a good question. So asthma is a chronic disease as well as a few other breathing disorders. So part of the understanding if you have asthma or not involves going to a physician and that physician helping to break that down and rule out many other diseases. Again, the typical ones that happen seasonally, RSV, flu, cold, all those will get ruled out when you go to a physician.
Okay, and the next question and statement, I have asthma. If I were to have COVID, would my recovery be more difficult or make my asthma worse?
COVID will, in fact, make asthma worse. The problem with COVID, actually, is that it feeds off other chronic diseases. So if you are somebody, like we looked at those slides, that already has a small amount of swelling happening in their airway at all times, even if you don't have asthma, getting an additional disease on top of that can make that disease feel worse in the long run. So making sure you have your asthma under control will help with the process of getting over whatever other disease that you end up getting.
Okay, and the next question we have, can you grow out of childhood asthma?
Unfortunately, you cannot. Childhood asthma is something that stays with you forever. However, it has been shown that symptoms can decrease over time. I know, for instance, my wife had childhood asthma and she ended up having to use her inhaler on a daily basis when she did exercise, things like playing soccer out in the field. And nowadays, she's typically fine, though there are times where she gets exposed to a trigger and will begin to feel those effects. Now, it is much less than when she was a child, but she still does have asthma.
Okay, and our last question is there anything I can do to prevent asthma or other breathing related illnesses?
Unfortunately, there's no way to prevent asthma. There's just good ways to manage it. And that's one of the reasons we're doing this presentation today, is to make sure people understand there are things you can do to keep it under control, though prevention completely from asthma, you will always have, once you've been diagnosed with asthma, you will always have that asthma carried with you, which is why it's so important to make sure that you manage and control it.
Okay, and thank you, Ryan, for this insightful presentation. This does conclude our program. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.